On 4th of May, World Health Organization opened up a district support office in Gorkha district, Nepal, the epicenter of the 7.8 magnitude earthquake that rocked the country and claimed the lives of thousands. A week later, a devastating 7.3 aftershock brought with it more death and injury, placing further strain on the country's already weakened health system and infrastructure. WHO has been actively supporting the government of Nepal, working to increase healthcare provision and access for affected communities, mobilise and coordinate essential medicines, medical equipment and health workers, and boost communicable disease surveillance capacity in the 14 severely affected districts. Its Gorkha District Support Office continues to lead and provide technical assistance to health partners active in the district. Members of the team outlined some of the health needs and challenges.
The field office in Gorkha has been established since 1 month now, and we have 2 co-leads for the health cluster, one logistic support team, one field coordination team, and we also have hired a local guy named Santosh for the IT support.
The major needs, the health needs were, the first of all was ensuring that people who are actually injured were actually taken care of. There are about 2,000 people who are injured, though fortunately very few deaths were actually there in this district. Injuries were, some of them were minor, but some of them were also major in terms of head injury as well as spinal injury. And the hospital, the district hospital here, could take care of certain of them, but then quite a few of them had to be also referred to either Kathmandu or to Pokhara. And later on, when the Swiss medical team actually arrived, then they were able to take care of some of the trauma here itself. Attendant to this was the psychosocial trauma, that psychological trauma that people actually faced, both the victims' families, those who were injured, but also those who had actually lost their houses and property, etc. So initially, the need for psychosocial or first aid was quite important, and that was done at the hospital level. And then later on, some amount of psychosocial support is being provided to families who had lost their loved ones, or who have people who are injured and cannot go back to work, who need long-term rehabilitation, etc. The other main issue was the destruction of the health facilities. 90% of the health facilities were damaged, and so primary healthcare services, especially delivery, birthing, neonatal care, etc., those kind of services could not be provided. This was complicated by not just the health facilities being damaged, but also the health workers being themselves affected. They're losing their houses and property, and so nowhere to really live. Some of them did not even have the basic amenities to be able to work at the health facilities. This complicated matters. So restarting some of these health facilities or providing these services through mobile medical camps was again the second priority once the injury, etc., were taken care of. Then with the health workforce as well as the health facilities being damaged, it was necessary to keep a tab through various means on the disease prevalence and the disease incidence, so that we are aware of what is actually going on, as well as ensuring that disease outbreaks do not happen, or if it happens, we will be able to catch it very early on so that we can actually do control measures. So these are the basic kind of health needs in the immediate as well as in the intermediate term, which were actually addressed.
Since monsoon is coming very near, and access to the remote village development committees will be very difficult.
Some of these areas, especially in the northern areas, several VDCs, village development centers, cannot be actually reached by road, and they had to be either it has to be by trekkers, or it has to be done by airlifting.
In terms of setting the temporary health facilities, as well as providing the essential needs to the health facilities, because the road access is blocked after the monsoon starts, and even the VDCs which were unable by road has to be taken care by the helicopters. But then with the bad weather, even helicopters becomes difficult to land. So providing the basic medical supplies becomes a big challenge for us.